Hi everybody. Today we're going to do a quick review of the endocrine system as it relates to anatomy and physiology. This should be an overview, so we're not going to spend a lot of time on this, and it will not be discussed in class. So the function of the endocrine system is to basically work with the nervous system to regulate body functions and maintain homeostasis. The functions are closely coordinated and complementary to each other. So that's why a lot of times when you think of the endocrine system, you should kind of see it in the terms of a neuroendocrine regulation. So the actions of the endocrine system include regulating metabolism, growth, fluid balance, sleep, bone density, reproduction, immune system, and stress response. At least for this course, you will not be responsible for things that are related to growth and the reproductive system. I still have the information in here, but I have it kind of in a light gray font just so you can see where it fits in, but you will not be responsible for it when it comes to testing purposes. So how do they work? So endocrine glands do not have epithelial ducts, so basically they are ductless, which means that when hormones are released, they go directly into the bloodstream. Some differences between the endocrine system and the nervous system. The endocrine system releases hormones, travels through the blood. The reaction is usually slow, but their effects last longer, versus the nervous system, where messages are sent through neurotransmitters, travels through nerves. The response typically is rapid, but the response time is usually short-acting. The mechanisms of hormonal actions. It modifies the activities of target cells, and you'll hear me talk a lot about this, especially when we get into diabetes, when we talk about insulin. It has like a lock and key mechanism. Hormones typically bind to the receptor and start a biochemical chain reaction that can change the pattern of the activity within a cell. And here's also a very important fact is that typically endocrine glands are not near the organs that they affect. And when we look in a little bit deeper, you will see the relationship and also understand why the reaction time can be a little bit slower, since it actually needs to travel through the bloodstream to get to the organs that they affect. Hormones can only affect specific cells or tissues known as target cells. An example, thyroid stimulating hormone only works on thyroid tissue. Most reactions in terms of how hormones are regulated is in a negative feedback loop. So when there is a reduction in the production of hormones, basically then the amount of hormone levels in a person drops. When it gets to a certain threshold, it will actually stimulate that more hormones are needed to be produced, which then you get your rise in the hormones, and then it kind of gets to, again, another threshold in which the body stops producing it. And that's in a perfect system. But you'll obviously see when we later talk about some disorders where there is some interruption within that negative feedback loop. So the different parts of the endocrine system that we will focus in on is the hypothalamus, which I would kind of call as the boss of the endocrine system, your pituitary gland, the thyroid, the parathyroids, the adrenals, and the islet of Langerhans. And the other three, the gonads, the pineal, and the thymus, you will not be responsible for testing purposes. So when we talk about the hypothalamus and the pituitary, again, the hypothalamus has nerve and glandular tissue connected to the posterior pituitary by nerve fibers. So you can see here how the nerve fibers actually go down into the pituitary. and to the anterior gland by a closed circulatory system. The posterior lobe actually stores hormones produced by the hypothalamus, where the anterior lobe can produce hormones when stimulated by the hypothalamus. So the way I talk to students to remember which does what, I kind of think of it in terms of a car. Let's see here. So the anterior, which is the front portion, I think of that as the front of a car. And what's in the front of a car is a motor and a driver. And so in that respect, I think the anterior has the capability of them producing hormones and releasing them. Where, as you see, I have highlighted here, the posterior I think of as like a trunk which stores. So if you kind of think of it maybe in that respect, you'll be able to keep it straight. So some hormones released by the hypothalamus are stored in and released from the posterior pituitary, as you can see here with this picture, where the hypothalamus creates some different hormones and sends a message to the anterior pituitary. It's either going to be a message for the anterior pituitary to release hormones or a message to inhibit the release of hormones. And as we go a little bit further in here, some of the areas here, like I said, I have them kind of dimmed, so you don't need to know this for testing purposes, but I wanted to show you where they fit in terms of the endocrine system world. But what you do need to know are these other things, and this should be a little bit easier for you to remember. When we talk about the posterior pituitary, all you need to think about is that it stores ADH, antidiuretic hormone, which promotes the reabsorption of water in the kidney tubules. That's it for the posterior pituitary. If you at least remember that, then you should then know that any other hormone that you are questioned about will come from the anterior pituitary, which includes your thyroid stimulating hormone, or TSH, which stimulates the thyroid, which then creates thyroxine, which is your thyroid hormone, which affects metabolic rate. Then you have your ACTH, your anticorticotropic stimulating hormone, which affects the adrenal cortex, which then produces cortisol, which raises glucose levels in the blood. And that is all you really need to know. Growth hormone also comes from the anterior pituitary, which stimulates growth. So if you know all this, you'll be okay. And again, the best way is remember the most simplest thing, that ADH is stored in the posterior pituitary and released by it. The posterior pituitary releases stored hormones to directly act on target tissues. Again, antidiuretic hormone. It stimulates water retention by kidneys to decrease urine secretion. Your anterior pituitary hormones have a direct effect on tissues, like growth hormone, regulates other glands, like this thyroid stimulating hormone, and then the adrenocorticotropic hormone, or ACTH. Your anterior pituitary has a direct effect on other hormones, with like the growth hormone, stimulates growth, and also fat, carbohydrate, and protein metabolism. Anterior pituitary also has an indirect effect hormones with the TSH. It stimulates thyroid growth and secretion of thyroid hormones, which again manages metabolism. Your ACTH, which stimulates adrenal cortex growth and secretion of glucocorticoids, which also works on the adrenal glands. So here, if you want to take a moment just for a break and enjoy this comic strip, if not, you can go ahead and keep moving. Alright, so now we're going to talk about the thyroid gland and see where it's located in relationship to the body in terms of anatomy. The thyroid gland is stimulated by TSH, which is released from the anterior pituitary. It produces three major hormones: thyroxine, which is T4, triiodothyronine, which is T3, and calcitonin. And to go in a little bit more depth, which you don't need to know, but in terms of thyroid hormones, T4 usually is converted into T3. But most people, when you're talking about thyroid hormones, is going to be your T4 and T3. Synthesis requires iodine. So that's why, if you never thought about it, why our salt is iodized. And this also works on a negative feedback system. So T4 and T3 have effect on the metabolism of lipids, your metabolic rate, the oxygen consumption by cells, also glucose uptake by cells, caloric requirements, nervous system activity, growth and development, and function of the brain. Calcitonin, which is secreted by the thyroid. So calcitonin is not regulated by the anterior pituitary. Its secretion is actually stimulated by high calcium levels in the blood. And so when there are high levels of calcium in the blood, what happens once it is activated, it inhibits the reabsorption of calcium from the bone, it increases storage of calcium in the bone, and decreases circulating levels of calcium in the blood. So when there are high levels of calcium in the blood, it basically activates the calcium to go back into the blood. The parathyroid glands are going to be these four little glands, and they actually sit on either side of the thyroid. So there's always two on either side. So there's four glands. So they're embedded in the posterior side of the thyroid. They secrete parathyroid hormone, or PTH. It is stimulated by the removal of calcium from the bone. PTH stimulates removal of calcium from the bone to increase levels in the blood. So if there are low serum calcium levels in the bloodstream, PTH is activated by that, and then it will basically convert calcium that is stored in the bone to go out into the circulatory, into the bloodstream, circulate in the bloodstream. Also increases the kidney's reabsorption of calcium, so there is less loss in the urine. It is activated by vitamin D, which enhances the calcium absorption from food within the stomach. And again, the secretion is regulated by the calcium levels in the bloodstream. So in terms of calcitonin and parathyroid hormone, their regulation has more to do with the levels of calcium in the bloodstream. The adrenal glands, they sit on top of the kidneys. They play an important role in metabolism, fluid and electrolyte regulation, and parasympathetic responses. There are two parts. There is the cortex, which is 90% of the gland. There are three different layers of that, and then the most inner layer is the medulla, and you kind of think of that within the middle, M for medulla. The cortex produces three kinds of hormones. Your glucocorticoids, the main one is going to be cortisol, and we will talk a lot about that in class. It's regulated by the hypothalamus and anterior pituitary. It also produces mineralocorticoids, which the main one is aldosterone, and that is not under the control of the pituitary. So the regulation of cortisol, if you kind of think about it through steps, when there is decreased cortical levels, it will stimulate the hypothalamus to release corticotropin releasing hormone, or CRH, which then stimulates the anterior pituitary to release ACTH, which then triggers the adrenal cortex to release cortisol. So again, this process is a negative feedback loop. Cortisol is a glucocorticoid that comes from the adrenal cortex. It has a permissive effect on some body functions, such as catecholamines, which is a chemical action, and maintaining normal excitability of the heart muscle. It also has an effect on carbohydrate, fat, and protein metabolism. A lot of students are familiar with its response in terms of stress. It also plays a part in emotional stability and immune function. Blood cortisol levels are affected also by the sleep-wake cycle, which is your circadian rhythms and stress. So levels are lower at night and actually rise in the morning. And what's important about this, we'll talk more about it again when we get into diabetes, but because if there are elevated cortisol levels in the body, you will also have higher glucose levels as well. And so there can be sometimes issues with how the cortisol levels are during the night and how people can have some issues with their glucose levels. Aldosterone is a mineralocorticoid which comes from the adrenal cortex. It works in the kidneys to maintain extracellular fluid volume. It promotes sodium and water reabsorption and also promotes potassium excretion. The regulation of aldosterone, basically when there's a decreased blood flow or blood pressure, the volume actually triggers the release of renin, which is an enzyme, and that's when the renin converts the substrate to angiotensin-1, and then that angiotensin-1 converts to angiotensin-2, and then the angiotensin-2 stimulates the release of aldosterone. Renin, just as a side note, is produced in the kidneys. And so this will show you how aldosterone is actually regulated and what triggers it. And just to kind of give you a sense of your renin-angiotensin-aldosterone system, and the part that you have focus on, at least for the endocrine system, where that comes into play, is what's shaded here in yellow. The medulla, which is the middle part of the adrenal glands, is stimulated by the sympathetic nervous system to produce catecholamines. There are 3 types of catecholamines: dopamine, epinephrine, and norepinephrine. The secretion is typically controlled by the brain center and not the pituitary hormones. So this is where, in the beginning, I talked about the kind of partnership between the nervous system and the endocrine system. And one way that I always remember that the medulla produces catecholamines is, you're going to laugh when I say this, but I always say that catecholamines is produced by the medulla. So I know it's a real far stretch, but I just think of cat and kind of meow with medulla. Like I said, it's a stretch. When we talk about some of the catecholamines, and you'll see this more in when we get to the cardiac system, but epinephrine affects alpha receptors, where norepinephrine affects beta receptors in the cardiac muscle, and this has a part of our stress response, or our fight or flight response, and this is where you will get your increase in heart rate, and respiration rate. The effects of aging, in terms of the thyroid, there is a decrease in basal metabolic rate. The pancreas, you will sometimes see a decrease in insulin production and increase insulin resistance. In terms of the gonads, decrease in estrogen production and decrease ADH. So it's kind of like buying a car when it's new, everything seems to work, but as it ages, it just doesn't work like it used to, and unfortunately that is some of the effects of aging. Unfortunately, with aging, it's difficult to assess for abnormal function, just because of chronic illness can take a part of it, changes in sleep patterns. Elderly sometimes are on multiple medications. There's some alterations in their diet activity, and with the decrease in muscle mass, and sometimes the clearance of the hormones. So it's kind of difficult to assess where is the issue in the endocrine function, but with all the different factors, it does have an impact on it. So as a nurse, the best thing you can do is encourage regular screenings. Fasting and postprandial blood sugars are really important for our patients as they get older, to make sure they are not pre-diabetic or diabetic, monitoring calcium levels and thyroid function. And we'll talk more about especially thyroid function in women. What is typically recommended is screenings after the age of 50. So when you're talking about assessments, when assessing your patient, it is key to recognize a collection of signs and symptoms that indicate an endocrine problem. Unlike other diseases, the effect of endocrine dysfunction can affect the whole body in seemingly unconnected ways. And so that is why it is sometimes difficult to pinpoint an endocrine dysfunction. Also, knowing the actions of hormones and the pathophysiology of endocrine problems, it is really the only way to know what a set of symptoms is related to a hormone imbalance. And again, it is important to identify a pattern as pointing to a specific endocrine problem. So that's about it. If you have any questions, feel free to ask. So make sure you brush up on your anatomy and physiology of the endocrine system and have a good handle on that, because it will be helpful when we talk about the disorders. And that's a wrap.